Hello, I'm Dr. Susie Naguib, Clinical Director at Sunfield Center in Ann Arbor, Michigan. I'm joined by Dr. Pamela Dixon, Director of Clinical Services and Inclusion at Autism Speaks. Dr. Dixon leads the implementation of the Autism Speaks World Health Organization Caregiver Skills Training Program, which was designed to empower parents and caregivers of children with disabilities around the world.
Dr. Naguib and I have focused our careers on providing evidence-based care and training to families and professionals around the world. We recognize that the COVID-19 pandemic has created significant hardship for parents and children alike, and one of the most visible ways in which it is affecting children is through school closures. Over 1 billion children in approximately 200 countries across the world have had to stay home due to the pandemic. And while remote schooling is necessary right now, it is obviously not the ideal environment for most children to learn.
Dr. Dixon and I will provide you with effective strategies that you can use at home with your elementary school age children in order to help them and you with remote schooling. These strategies will focus on 4 main areas, including being kind to yourselves and your child, using positive parenting strategies, identifying a location, and creating and sticking to a daily routine. When you use these strategies consistently, you will foster a more positive, supportive, and nurturing learning environment, which will help reduce stress and make learning easier. These strategies can be helpful for most children, including those receiving special education. However, some children will need more individualized supports.
Remember to be kind to yourselves and your children. The expectations placed on parents are greater than ever before. In addition to supporting remote learning, many parents are also juggling full-time jobs, caring for younger children in the home who may require a lot of attention, or they're having to provide a one-on-one support for children with special needs. We recommend that you consider the following strategies. Use positive self-talk to help you through difficult situations. Tell yourself things like, "My child is trying her best and I'm proud of her." Or, "I know I'm not the only one going through this right now and I'm going to be okay." Engage in self-care activities. Go for a short walk or take 5 minutes to yourself. Put yourself in your child's shoes. They may be missing their friends, they may be experiencing anxiety about the pandemic, or they may be struggling with remote schooling. Your patience and your words of encouragement will help your child during this time.
Positive parenting strategies help children regulate their emotion and gain better control over their behavior. Here are some strategies that you can use that are adapted from an intervention called Parent-Child Interaction Therapy that was developed by Dr. Sheila Iberg. These strategies help promote positive child behaviors. Praise your child's positive behaviors. Remember to be specific. Specific praise lets your child know exactly what it is that you like about the way that they're behaving and will make them want to do it again. For example, Allegra, I love that you're so focused while you're completing your schoolwork. Reflect or paraphrase the positive things that your child says. For example, when your child says, "I read for 20 minutes, you can reflect their words by saying, "You did read your book for 20 minutes. When children feel like they're being heard, they communicate more. Here's another example. When your child says, "I'm tired of working on this math worksheet," you might think that that's a complaint, but in fact, your child is expressing their feelings while using their words, and that's a good thing. So you can help them feel heard by saying, "I know you're tired of working on this math worksheet. You've been working on it for a long time." Describe your child's positive behaviors. When you describe your child's positive behaviors, they're more likely to continue to engage in these behaviors. For example, "Carolina, I see that you're sorting all the vegetables. Daniela, you're making 12 butterflies." Enjoy interacting with your child. Express your enjoyment through the tone of your voice, laughter, and positive touch. Ignore minor misbehaviors. By ignoring attention-seeking behaviors, such as whining and crying, you are teaching your child that you respond differently to positive and negative behavior. And even though ignored behaviors will initially increase, when you consistently ignore those behaviors, they will improve over time. In order to ignore, you should look away, maintain a neutral facial expression, refrain from mentioning the negative behavior, and praise another behavior that you see that is positive.
These are some additional positive parenting strategies that you may consider. Modeling positive behavior. Children learn by watching and imitating what we do. Now, this is true for positive as well as negative behaviors. So make sure to show your child what you expect by being a good role model yourself. So for example, if you want your child to sit down at their table and pay attention to what their teacher is saying, you can do the same. Use the PREMAC principle. When used intentionally, the PREMAC principle, also known as Grandma's Law, offers a powerful way to build motivation and change behavior. It states that behavior that an individual chooses to do on their own will reinforce or encourage a less preferred behavior. So in other words, you can motivate your child by saying, when you complete your assignment, you can play outside. This gives your child something to look forward to, making the unpreferred activity easier to get through. Consider using a behavior chart. If your child needs additional support, consider implementing a behavior plan. At the start of the COVID pandemic, Dr. Naguib and her team at Sunfield Center produced a video about the cooperation chart, which is a behavior plan created by Dr. Cheryl McNeil. You can follow the link to access the cooperation chart video, as well as download Dr. McNeil's PDF explaining how to implement it.
Having a designated location will make it easier for your child to focus on their schoolwork. We recommend that you consider the following when trying to identify adequate locations. Provide a desk or table workspace. Children will benefit from having a specific desk or table away from television screens and other distractions. Create a cozy work spot. It's difficult for children to stay seated in one location all day. Therefore, it is important to provide alternative workspaces where your child can be comfortable while learning. Adapt your child's seating if necessary. A wobbly stool can be helpful for children who have difficulty staying seated. There are also other creative ways in which you can adapt seating to meet your child's needs. Make supplies accessible. Needed school supplies should be readily available in a predictable spot at your child's work area. This will help them stay on task and not wander away looking for materials. Provide your child with headphones if they will be sharing a workspace with others.
One of the most important things you can do for your child is to create and stick to a daily routine. A routine helps to clarify daily expectations and makes transitions easier for your child and for you. The following components are essential elements to incorporate into your daily routine. Make sure your child is well rested. It is important that your child is well rested in order to be ready to learn in the morning. It's recommended that elementary school-age children sleep from 9 to 12 hours per night, according to the American Academy of Pediatrics. Using an alarm clock can help to ensure that your child wakes up at the same time every day. Make sure your child is well fed. Making sure that your child is well fed will help them better engage in learning activities. When hungry, you may find that your child becomes irritable and may refuse to do the things that you want them to do. And children are not always good at recognizing and communicating when they're feeling hungry. Make sure that you're providing a meal or a snack about every 1 to 2 hours. Provide physical movement breaks. Studies show that children are better able to focus after engaging in physical activity. Teachers are providing physical movement breaks during online instruction, so encourage your child to participate during those times. Additionally, create a predictable time in the morning and the afternoon where you can take your child outside for recess. If you need to stay inside, make sure to encourage your child to do something active that does not involve a screen. So for example, dancing to music, doing jumping jacks, push-ups, or stretching. Create and display a visual schedule. This helps children know what is happening next and reduces dependence on caregivers. A visual schedule incorporates all of the activities of the day. This includes academic tasks, snacks, and meal times, as well as recess. Once you've created a visual schedule, make sure to display it and start each day by reviewing it with your child. We also recommend using a timer to help you and your child stay on task. And if needed, you can adapt the visual schedule even further by turning it into a checklist for your child to mark off as they progress throughout the day.
Dr. Dixon and I hope that you find these strategies useful. Remember to be patient with yourselves and with your child. And try your best each day to balance the demands of remote schooling with your child's need for play and downtime. When you apply these strategies consistently, you will foster a more positive, nurturing learning environment that will make this easier for both you and your child. You can download a written copy of these recommendations from our website, along with the images that we created for you to make your very own visual schedule. You can also click on the link below to access these materials.
Remember, we are all in this together. Many parents are experiencing higher levels of stress that may be impacting their own mental health and their ability to care for their children. This may be particularly true for parents whose children received one-on-one support in the classroom prior to COVID-19 and who now find themselves having that additional responsibility. We encourage you to continue to communicate with your child's school team any concerns that you may have. And if you need additional support, reach out to a psychologist in your area.
From Dr. Dixon, myself, and our team at Sunfield Center, we wish you a safe and peaceful school year.